Hi, I'm Dr. Cameo Carter, board certified pediatrician. Welcome to the end of my day. Today, I'm reflecting on a visit I had with a couple of siblings and their mom that I hadn't seen for a little while now. And to give some background for this visit, unfortunately, we're no longer in network with their insurance. And it was a really hard decision that I had to make for our practice to discontinue the contract with this insurance. And I preferred to not have had to do that, but the insurance just was not paying us enough to be able to continue to see the patients who had that insurance. And in fact, it was costing us to see those patients. And so we had to discontinue that contract. And this family has had a bit of a difficult time finding a new pediatrician that does take their insurance, and they feel has gotten to know them well and understand their concerns and have had some issues going round and round with them. And this discussion today is in no way to disparage any other primary care physician. And I think it's important that we understand that we're not always in the position that other doctors are at the time. And we're only hearing one side of the discussion. But I do know that these primary care relationships are really important to establish, and it's significant to have followed a patient for a time and to know a lot about their history and to have a good rapport with a family. And it's something that I know pediatricians value very much. We appreciate that as well. I think it's important that as we're teaching medical students and young doctors, that we are continuing to emphasize listening skills. Patients may say words that have a medical specific meaning, but might mean something different. I can think of the term wheezing, for example. To people who aren't medically trained, the term wheezing is just noisy breathing. In medically trained people, we know that wheezing is a very specific type of sound that we hear, and it means different things about where issues are occurring in the airway. So that's one example. And so it's really important that we teach how to listen, how to ask the right questions. And I think that the additional point that needs to be made with that is that it is increasingly difficult for primary care physicians to be able to have the time and the opportunity to listen like we need to. We are being crunched for time. And it's not just in the big corporate practices. I've seen online a lot of people talking about that it's the corporations that are forcing physicians to see patients more quickly. And it really isn't the big hospital systems per se. I'm in private practice, and I face the same time crunches because the real issue is with insurance companies. They pay us very little, and in order to be able to pay staff to keep the lights on, to do all the overhead that is required to run a business, doctors are having to see more patients in a shorter amount of time, and it is very hard to be able to listen very proactively, to ask a lot of questions, and especially when patients may have a lot of concerns. Also, patients are paying more and more for insurance, and their co-insurance or their deductible might be more significant. And so what I've seen over the years also is patients, families saving up visits and say, oh, we're already going to have a well visit in a month or two. And so we're going to talk about all of our concerns at that time. And so we'll save up quite a bit to discuss. And that is even harder because, for instance, for a well visit, we have a lot that we feel we need to cover in order to be thorough and to do everything that we should be doing for our patients and the questions that we ask and the topics that we cover. And it's hard to address all of those things in the allotted time that we really have. And then when there's additional concerns that come up after that, how do you additionally fit that? So you want to meet the needs of your patients, absolutely. And then you have other patients who are waiting after that. And in our field, in pediatrics, it's very hard for a young child to wait. It's hard for parents with young children to wait. And so there's those constant pressures. So at the end of the workday today, I was reflecting on this visit that I had with these patients because they had felt that they hadn't been heard and weren't getting the directions that they needed. And the parent said to me, I also don't feel like I have the right language in order to communicate what my needs are. And I thought that was articulated really well because we shouldn't expect our patients to have the right language to know exactly what referral is needed to what specialist, why. But we as doctors also need the time to be able to sort that out, to figure that out, to be able to do the coordination of care. And with these patients who, since they're not network, they paid out of pocket for their consultation to meet with me today. I had a defined amount of time also, knowing ahead of time that they had some questions and needed some coordination. I scheduled them for the end of my half day so that I could work through my lunch and take the time that I needed to for them. And I know lots of other doctors that do that too. But is that fair and appropriate? Is that good for our mental health? I don't know any doctors who take time out for a lunch break. We all work right through. And so as I'm thinking and reflecting about that, I think that this is something that we need to make sure that we're talking about and that people are aware of, because we really need to address the system in a way that is seeking to solve problems. Patients need our time and attention. And yes, we do this for our income. This doesn't mean we're just in it for the money, but we all have jobs that we do to support our families. As physicians, we went into a job that we wanted to serve people, and we dedicated a decade of our life to study, to go to school, to get training, to do that. So I think sometimes doctors are reluctant to talk about the financial strains and implications because of the concerns that people say sometimes about just being in it for the money. But it is a job that we have, a job that we love, and a job that we want to be part of service. But we also need to make sure we're addressing the things that are putting limits on us being able to do our jobs well. And we need to be able to have time. And trying to squeeze more and more out of primary care physicians is going to and has led to patients not always getting what they need. So at the end of the day, on top of all that doctors are doing already, I think being willing to speak out about the strains that we're having is important. To not be slamming other doctors, to understand that doctors are doing, in most cases, the best that they can in this system that is not designed for patients or doctors, and to start demanding that we create a different system.